Okay, everybody, this is the fifth and final have-to heal heart disease. And I told you I was going to keep this one a secret, and the reason why is I don't think you would have watched it if I would have told you. But today is all about chiropractic care. Oh, Dr. Ryan, I knew you were going to talk about this at some point because you're a chiropractor. But here, listen, I want you to hear me out, that the most overlooked treatment or preventative measure that you can take to either prevent or even heal from high blood pressure, high cholesterol, and heart disease is specific corrective chiropractic care. And here's why. There's six things that research has shown to benefit people with heart disease. Number one is studies show that specific adjustments to the C1 or atlas vertebrae affect the vagus nerve. Vagus nerve comes out of your neck, goes all the way down into your heart, and regulates blood pressure. You know, and you might think, well, what's the big deal with that? Well, remember that everything in your body is controlled by your brain, right? For your heart to beat, lungs to breathe, eyes to blink, for your stomach to digest food, even for a cut to heal on your skin, your brain controls all that. Your brain sends energy like electricity down the spinal cord, through the nerves to every cell, tissue, and organ in your body. It's just like the electricity in a building. As long as the electricity can flow, then the appliances on the other end can work like they're supposed to. And what happens is your spine, which has 24 movable vertebrae, basically moving bones, movable bones, and those bones, because of stresses in life, like car accidents, sports injuries, bad posture, the birth process, slips, trips, and falls, these bones can shift out of alignment. When they shift out of alignment, that condition is called a subluxation. Subluxation just means when your spine's out of alignment, and then it weakens and damages those nerves, because it's kind of like a kink in a hose. The energy can't flow through there. Well, if you kink the hose or you pinch the nerve that's going to your heart and regulating blood pressure, it makes sense that by removing the pressure or removing the interference, all of a sudden the appliance, or the heart in this case, would be able to regain function, restore normal function, blood pressure normalizes, and the body can equilibrate. And studies show this. There's a study that was done, they took people that were on 2 different blood pressure medications and compared them to patients that had their C1 or atlas adjusted to affect vagal nerve tone. And they actually found that people that got chiropractic adjustments, specific corrective chiropractic adjustments, had better results at lowering or even reversing high blood pressure. Pretty awesome, right? So that's number one. Number two is specific corrective chiropractic care increases autonomic tone. What the heck is autonomic tone? I'm glad you asked. Autonomic tone, you have 2 sections of your nervous system. You've got sympathetic and autonomic. Autonomic are all the nerves and functions that automatically happen in your body, like breathing, digestion, immune system, and blood pressure or heart rate, right? And so by getting adjusted, studies show that it increases autonomic tone in the heart. Basically, the sensitivity of the nerves in your heart to detect stimulus. It's kind of like a thermostat. Like you want your thermostat really on point, really sensitive, because if you want it at 68 and it's 69 because it's hot outside, you want that thing to kick on and bring it back down to 68, right? If it's too cold, you want the heat to come on. You get the idea. So autonomic tone basically allows your heart to detect stimulus to either speed up or slow down blood pressure, heart rate, so on and so forth. So that's number 2. Number 3, studies show that specific corrective chiropractic care lowers or reduces markers of inflammation. Why is inflammation such a big deal? Remember, you can go back and look and watch the de-inflammatory diet video that we talked about. Inflammation is basically when your body's in a crisis, your body's inflamed and it becomes super sensitive. And so we know that when blood vessels are inflamed, they constrict, they get hard, and it's harder for your heart to pump blood through your body, right? And if it's harder to pump blood through your body, then the tissue cells aren't getting as much nutrition, they're not getting hydration, they're not getting the oxygen that they need. They're also not being able to send back the waste products, toxins, and all the things that your body's trying to get rid of, right? So number 4 is to increase heart rate variability. What does that mean? Heart rate variability is when your heart is able to go up and down, depending on certain stimulus. A bad thing, and it may be kind of counterintuitive and hard to understand, but just know that you don't want your heart rate the same all the time. You want it adaptable. You want it variable. You want it to be able to go up really quick and down really quick, and up really quick and down really quick, as long as they're in accordance to the environment or the stimulus. If you're super stressed out and your heart rate stays the same, or if you're really relaxed and your heart rate still stays the same, that's not a good thing. In fact, a lot of doctors or functional medicine doctors or wellness people, they're testing HRV, heart rate variability, as measures of good health and longevity. So specific corrective chiropractic adjustments increase heart rate variability. Number 5 is decreases chest pain. And this one's probably obvious, but when you got a lot of chest pain, when you feel constricted, it's harder for your heart to work. And one of the things that causes increased chest pain is something called forward head syndrome or forward head posture. A lot of medical doctors actually call this heart attack neck, because what happens is when your head shifts forward, it puts a lot of strain, mechanical stress and strain on your upper back. And your upper back muscles have to work a lot harder. For a lot of you, that's why you have that hump right there, is because those muscles are trying to work hard to hold your posture upright. But the other thing is when your head's forward, it causes your shoulders to round, your thoracic cage or your chest constricts, and now you just don't have that much room for your heart to pump, right? Your heart's got to have some room to be able to move freely and pump. And so by getting adjusted, oftentimes we can open that thoracic spine up, reduce forward head posture, and minimize the amount of work that the heart has to do just to accomplish the same exact thing. And then the last thing is improved breathing, and it's the same reason. Studies show that by getting specific corrective chiropractic care, especially rehabilitative spinal care, where you're regenerating your posture and reducing forward head posture, and you're taking pre and post x-rays to make sure there's structural change, you can actually improve or increase efficiency of the lungs, right? And the reason why that's important is because if you've got a heart that's not pumping enough oxygen through the tissue cells, then your lungs have to work a lot harder to breathe harder, and then that can lead to things like pulmonary disease or asthma, because your body's constantly trying to get more oxygen to the tissue cells because the heart has to pump more blood to get the same amount of oxygen, right? And so by getting your spine alignment, it improves neurological function, reduces inflammation, reduces chest pain, increases your body's ability to breathe with efficiency and ease. If you haven't had your spine checked, you have to, and you got to go to a chiropractor that takes x-rays, right? We x-ray everybody in our office before we adjust them, unless you're pregnant or a baby, right? And it's because if you have the technology, it just makes sense. We can see exactly what's wrong with your spine just like that, right? And then we also take post x-rays. And it doesn't make sense to me. Chiropractors for years, some of them take x-rays and they give you a treatment plan. As long as your pain goes away, then you're done. But what if the structure never changes? Well, then we know that the symptoms eventually come back. And so what we do is specific corrective chiropractic care. If you don't live in our area, find an office that does this. Find an office that takes x-rays, that can give you a specific spinal posture rehabilitation program, and then takes post x-rays to make sure you actually went from point A to point B, right? Most people aren't testing to see whether or not you made it to point B. So I hope this helps you. Just know that if you're a patient of mine, every time you get adjusted, these things are happening in your body, even if you didn't know it, even if you can't feel it, even if the only reason why you're coming to see me is because you have neck pain or headaches. That's okay. I forgive you. But really, just know that your body's functioning at such a higher level. Your heart's working better, vagal tone's better, heart rate variability is improving, breathing's improving, all these different things. And it just makes sense. When you increase the brain's ability to communicate through the nerve system, just like turning up the electricity in a building, all the appliances work better, and it applies to heart disease as well. I hope this series has been helpful for you. Stay tuned to the next one, where we can continue to add more and more value and help you become the best you possible.